Hi, Dr. Hobie Fuerstman here with Preventive Medicine, here today to talk to you about a topic that I see a lot in my office, something that a lot of people struggle with, and there are many different reasons for it, and that is chronic fatigue. It's sort of an overarching term for when you're just not feeling your best, when you don't have the energy to do the things you do, when you don't feel the desire to do those things, when you just don't have that get up and go that you're used to for some or most of your life, when that energy just isn't there, something's lacking. And when you come in with an issue like that is really when we can start to have a conversation to really peel back the layers and figure out what could be underlying it. Chronic fatigue is a very large umbrella term that can encompass many different things. One of the most common ones we see is something as simple as burnout. And that basically just occurs when you've just been pushing too hard for too long. It can be in one area of life. Oftentimes, we'll talk about this with work. People get burnt out at a job. But the truth is, when you don't have the energy to keep doing what you're doing, your body will pull every trick out that it can to keep you going. You're burning energy stores, you're burning your body's ability to manage other energy systems, healthy organs, balance in the brain, in the heart, in the lungs, in the liver, and the kidneys. So when you're really sort of overstraining your body, usually through the cortisol system or your stress hormones, when you've really sort of shot that as much as you can, the body starts decompensating in other ways. And when that happens, we have to sort of first find the source of it, what ultimately has been draining you, but we also have to find ways to replete you in the process. Now, while burnout is a common cause, chronic infections can be another cause. Chronic infections can have a bunch of different forms. Bacterial, we do see a lot of Lyme disease here in Vermont and the surrounding area. Definitely something we want to talk about. We also see this in chronic viral infections. Everybody likes to talk about our current COVID situation, but there are also plenty of other viruses that have a host of complications that we look at as well. We see people with mono, we see people with CMV, and many other disease states that may not be so obvious at first, but really deserve sort of a further conversation and a better look. Beyond that, there are things like mold exposure, heavy metal exposure, all of which require a deep dive to see what's going on. Oftentimes, we can figure out a lot of what's going on with a conversation. That'll really get us where we need to go to take next steps. Beyond that, oftentimes we'll need to do some blood work to really look at what's going on underneath this and get some clarity. No matter what the cause, there's something we can do to move forward from day one, whether that be a supplemental approach, a lifestyle approach, a medication approach. There are a lot of different pieces that we can really look at to move the needle for you from day one. But first and foremost, what you got to do is come in the door so we can have the conversation to get things going and really start the process of getting you your energy back, get mojo back, get that sort of joy of life flowing again. Because ultimately, if you can't find that joy for life, it's hard to find those energy sources within you anyhow. So